Assalamu alaikum. Today I'll be presenting a systematic review and meta-analysis that published in International Endodontic Journal in 2025 by Moretto and colleague. The study titled with Association between Patient Age and Vital Pulp Therapy Outcome, Systematic Review and Meta-Analysis of Prognostic Studies. This study tried to investigate clinically relevant question that often determine our treatment plan decision, where does patient age affect the clinical and radiographic outcome of vital pulp therapy in mature permanent teeth with dental pulp exposure? Since the vital pulp therapy is increasingly used as a conservative alternative to root canal treatment in mature permanent teeth, especially with the availability of the bioactive material of calcium silicate based material. However, the patient age is still commonly considered as a limiting factor, with older patients often assumed to have a reduced pulpal healing potential. Although many studies reported higher success rate of vital pulp therapy, but their conclusion about the age are inconsistent, where some studies suggesting younger patients have better outcome, while others showed no difference. Including studies with clinical trial or observational studies that published between 2008 and 2024, done on direct pulp capping, partial pulpotomies, and full pulpotomy in mature permanent molars, with minimum follow-up of 1 year. The eligible studies has to report the patient age as a potential prognostic factors and assess the clinical and radiographic outcomes. And only treatment performed under rubber dam isolation using calcium hydroxide or calcium silicate based material, followed by definitive restoration, were included. A total of 34 studies were included, 13 randomized clinical trial and 21 observational studies, and 23 studies were eligible for meta-analysis. And follow-up period range from 1 year to 29 years. And most of studies involve dental caries as the most common cause of dental pulp exposure, and MTA were the most common capping material, followed by calcium hydroxide and other calcium silicate based material. The finding of this systematic review and meta-analysis showed the age did not affect the vital pulp therapy success, except for the direct pulp capping procedures in patients younger than 40 years had better outcome, were significantly higher success compared to the older patient, with the odd ratio of 4.85, indicating that teeth treated with direct pulp capping are 5 times more likely to success in younger patients. However, in partial and full pulpotomy procedures, the age was not significant prognostic factors. Importantly to mention that the certainty of evidence for these findings are ranged from very low to low studies in direct pulp capping procedures, and this observed association between the age and poor outcome in direct pulp capping procedure should be interpreted with caution, since the direct pulp capping procedures provided with limited visual assessment of the pulp status increase the risk of misdiagnosis of irreversible pulpitis. And since most of the direct pulp capping involve caries exposure, the finding may reflect a case selection bias rather than a true age-related limitations. As a conclusion of this study, the age alone should not be considered as a limited factor for vital pulp therapy procedures, especially for partial and full pulpotomy procedures. And clinically visual assessment of the pulp status, removal of the inflamed coronal tissue, and achieve of the hemostasis should be more relevant predictor of healing than age alone. Thank you.